Aspirin. The overdoses result from the accidental ingestion in the young children or suicide attempts in the adults. The major untoward consequences are metabolic with few morphological changes. At first, the respiratory alkalosis develops, followed by a metabolic acidosis that often proves fatal. The fatal doses may be as little as 2 to 4 grams in children and 10 to 30 grams in adults, but survival has been reported after the dose is 5 times larger. Chronic aspirin toxicity may develop in the person who takes 3 gm or more daily. The dose used to treat the chronic inflammatory condition. Chronic salicylism is manifested by the headache, dizziness, ringing in the ears, tinnitus, difficulty in hearing, mental confusion, drowsiness, nausea, vomiting, and diarrhea. The CNS changes may progress to convulsions and coma. The morphological consequences of the chronic salicylism are varied. Most often, this is an acute erosive gastritis, which may produce the overt or covert GI bleeding and lead to gastric ulceration. A bleeding tendency may appear concurrently with the chronic toxicity because the aspirin irreversibly inhibit the platelet cyclooxygenase and block the ability to make the thromboxane E2 an activator of the platelet aggregation. The petechial hemorrhages may appear in the skin and internal viscera, and bleeding from the gastric ulceration may be exaggerated. The proprietary analgesic mixtures of the aspirin and phenantine are its active metabolite. Acetaminophen, when taken throughout the cerebral air, and can cause tubulointerstitial nephritis with the renal papillary necrosis. The clinical entity is referred to as analgesic nephropathy. The injury to the non-therapeutic agents. Drug abuse generally normally involves the use of the mind-altering substance beyond the therapeutic or social norms. Drug addiction and overdose are serious public health problems. Cocaine. In 2014, it was estimated that there were 1.5 million users of the cocaine in the United States, of which approximately 15 to 20% were users of the crack cocaine, use in the highest among adults 18 to 25 years of the age, of whom 1.4% reported taking cocaine within the past months. Extracted from the leaves of the coca plant, the cocaine usually is prepared as a water-soluble powder, cocaine hydrochloride, but when sold on the street, it is liberally diluted with the talcum powder, lactose, or other look-alikes. Crystallization of the pure alkaloid from the cocaine hydrochloride yield the nuggets of the crack, so called because of the popping sound it makes when the heated. Thank you.